MCLU has long opposed laws that criminalize the cultivation, possession, use, sale, and delivery of marijuana for adults. Criminalizing adult use of marijuana is an unwarranted governmental intrusion upon individual autonomy. Privacy rights, contributes to vast over-incarceration, and is ineffective in addressing substance use appropriately as a public health issue. For all of these reasons, we urge you to support this bill. Marijuana prohibition initially imposes arbitrary, often harsh penalties for private conduct for which no criminal penalty is appropriate. And from a Fourth Amendment perspective, the methods of enforcing marijuana prohibition often rely on entrapment, illegal searches, and other means that violate people's civil liberties. We talked a little bit about, you heard a lot about with the last bill, some of the statistics on the drug war and the failure to address other drugs in this over 30-year fight. And despite low risk to users and even known benefits, marijuana-related crimes have played a huge part in the growth of this war on drugs. In 2007, America set a new record by arresting over 870,000 individuals for marijuana offenses, 89% of which were possession-only offenses. And in 2009, Maine arrested 2,900 people for simple marijuana possession. An American is arrested for violating marijuana laws every 30 seconds in this country. What we found is that filling our courts, police cruisers, jails, and prisons with nonviolent drug offenders has done nothing to reduce drug use, dependence, or availability. And in fact, as you've heard, part of what's going on in our state is that there are many folks who I've heard from who feel very uncomfortable with what was passed with LD 1811 last session and seek access to their medicine, but do not feel comfortable registering in a statewide database that's both proving they're breaking federal law and brings them under the guise of state agencies, including law enforcement and Department of Health and Human Services. So this would provide a way for those individuals to get the medication they need without violating the law. Lastly, many of the risks portrayed about marijuana use are overblown. There is no evidence, as some have suggested, that marijuana serves as a stepping stone to harder drugs on the basis of its particular physiological effect. Rather, it's marijuana's status as a prohibited substance, not its biochemistry, that links it to more serious drugs by relegating it to the illegal market where individuals may be exposed to the sale of other, more serious illicit substances. The vast majority of people who try marijuana do not go on to use harder drugs. It's more valid to say that the use of hard drugs is statistically associated with the use of alcohol and tobacco rather than with marijuana. According to the Institute of Medicine, most drug users do not begin their drug use with marijuana. They begin with alcohol and nicotine, usually when they are too young to do so legally. So what is the responsible fiscal and public safety solution? It is, in this case, it's decriminalization. The cost and personal impact of arrest and incarceration for marijuana possession is, I'm wrapping up, severely disproportionate to any societal harms incurred, especially when compared to legal substances like tobacco and alcohol, which can cause death from overdose. As a result, people across the country, including those of us here in Maine, are asking our government to reconsider our marijuana laws. By further removing criminal penalties for use of a substance that is naturally occurring, has known medicinal benefits, has never been known to cause death or serious illness from overdose, and is widely available, this is an appropriate step for Maine to take towards reducing mass incarceration and appropriately directing law enforcement action. Please pass this bill.
My name is Cindy Brown. I live in Starks. I am here to testify on behalf of LD 750 and 754. I strongly urge the decriminalization of marijuana possession and cultivation. Every year, citizens all over Maine grow marijuana for their own personal use. Most of them are never arrested. These are our neighbors, our friends, our family members. Every member of this committee most likely knows at least one of the growers. In many cases, these growers may be your own family members. They are not criminals. In my experiences, if the plants are discovered and the grower is arrested, what happens most of the time is that the person is fined and put on probation. They do not serve jail time. Instead, the resources of our courts are being used to make deals with the DA, take the precious time of the judges and the courtroom staff, monitoring payment plans and probation. This is a needless spending, and it is wasteful of our tax dollars. The time, money, and resources wasted by treating marijuana cultivation of 6 or fewer plants as a crime can be better allocated to the real crimes of violence that our most vulnerable citizens live with every day. The crimes of domestic violence, abuse of children and the elderly, rape and robbery. And still, after all this money has been spent, every spring, thousands of tax-paying, voting Maine citizens will continue to plant marijuana for their own personal use. The people of Maine are not criminals.
My name is Dave Wilkinson. Greetings, Senator Mason and members of the committee. I lived for a long time in northern Maine. I've lived in both sides of Maine. What I want to say is that this situation really interferes boldly in people's lives. Since 1969, when, as a young man of 25 with 2 children, a spy was sent into my house, ate off my table, played with my children, shot morphine under my roof, encouraged me to do the same, encouraged me to get involved in large drug deals. This was an agent of the government sent into my house. 2 weeks after he left, there was a home invasion. He collected $500 for ruining my life because that led to a divorce. And my life, it traumatized my family, traumatized my children. My life has not been the same since 1969. My life has not been the same since 1969. I have been diagnosed with PTSD. It's not entirely on account of this situation, but it largely is. It's 2 divorces. For many years, I lived a very respectable life in a suit and tie, just like you guys, doing working for some of Maine's largest corporations, put kids through college, and then in 1992, helicopters started to fly. Vietnam helicopters, black with a little cross on them that you could hear from 10 miles. What kind of a country are we living in? Treetop level. Well, I became involved, and I wrote an ordinance called the Starks Vote. And it is the only official legal vote in American or world history by any state, any county, any legal entity voting legally to legalize the cultivation and possession of 2 pounds of cannabis. The people of Starks voted for that, and they are the only people in the world ever to do so legally and officially. So I think this places Maine in a very unique position of leadership. We are a leadership state on this issue, and dirigo, Maine leads. We are not going to cut our society in 2 and make some people demonized, subject to stigma, stereotypes, and Stalinism for simply following science. Okay, I'm going to be brief. Can't give you 20 copies. I have brought you 4 copies of my novel. It's a social narrative, and at the heart of this book is a story which came out of legislative testimony given right here some years ago. And that legislative testimony, a father said about his daughter, who in the DARE program had been encouraged to turn her parents in for, I believe it was 18 plants in the closet. That ruined and traumatized their lives. And what this father said was, the cop taught my daughter to lie, taught her how to be a spy, taught her how to go undercover on her parents. Well, I wrote this in my novel, thought it was pretty gripping stuff. And then I read in the paper, one more story, a man, 55, in Oklahoma, committed suicide. Went out in the woods, shot himself with a .22. Why? Because his child had done just what I had written in the book. He had turned in this guy for 20 plants in Oklahoma. He went out and shot himself because of the shame, the fear, the horror that this prohibition, this irrational prejudice and hate. I'm a Unitarian. We're against this kind of thing, prejudice and hate. And that's what this is. We wouldn't be in this room talking if it wasn't because of prejudice, hate, and racism, which has taken us here. Let us never forget this. This is a human rights crisis.
Brian Eager from Gray, Maine. In weighing consideration of passage of this bill, there's many patients who are authorized to use medical cannabis for treatments of their various conditions that are non-smokers, either by choice or necessity. And this very significant sizable group of the population is forced to convert their medical cannabis into an ingestible form for their treatment. I personally am aware of many patients who only wish to undergo pain management by needing to convert their cannabis into an ingestible form. This requires a lot more of the cannabis in order to create a single effective dose. Patients that I've talked to regularly frequently have expressed that an ounce of cannabis only creates 4 or 5 effective doses, which translates to only 10 to 12 doses per month as legally allowed by the current restrictive possession limitations. If a citizen who needs or prefers to ingest prepared cannabis is legislatively limited in the amount of his or her effective daily required dosage, then it could be argued that the possession amounts previously considered and allowed under the current law reflect amounts established and defined by typical inhalation amounts per dose and should be adjusted fairly and consciously with medical patient requirements in mind to at least a minimum threshold of 5 ounces in order to provide an adequate 30-day supply to any legitimate patient or person choosing to use cannabis in this form. The decisions to base legal limit in possession are naturally considered applying a dose per ounce rationale. But given that many more individuals need or choose not to consider this method of dosage, but rather ingest the product, the dosage restriction may be unfairly biased and flawed by being based on data that is fundamentally discriminatory, with a bias against non-smoking citizens who must currently choose between either having reasonably consistent access to required cannabis limits for their pain management or risk violation of the law. And this places an undue burden on this very sizable group of Maine citizens.